Hi everyone, this is Tamika Newman and I'm an international board certified lactation consultant, and today I'm having a chat to you about antenatal expressing. So it's not uncommon for mums to want to do some antenatal expressing during their pregnancy, and that can be for various reasons. It can be because they're noticing that their breasts are leaking some colostrum. It can be that they want to be super prepared and have some colostrum ready if mum and baby is separated after birth. So antenatal expressing is often a great idea to get you really comfortable with your breasts and how they work, and it's also a really good idea to kind of wait until 36-37 weeks gestation before you're trying to do any hand expressing. If you notice your breasts are definitely leaking a lot prior to that point, you can definitely do some super gentle hand expressing and just collect whatever is coming out of your breast at that point in time, as long as you haven't been told that you need any cervical rest or anything like that during your pregnancy. Okay, so what do we need for antenatal expression? We basically need your breasts, and we either need a syringe. This is a 10 ml syringe. I don't expect most mums to fill a 10 ml syringe. A lot of mums will only get a little glisten, or even 0.3, 0.5 of a mil can be totally normal. It can also be a good idea to use a medicine cup as well. Some mums like to catch their colostrum in the cup and then syringe it up, and others just like to go directly with the syringe. So before we start, I always suggest that it's a really good idea for you to warm your breasts up so that we're getting lots of blood flow and things into your breast. So you can either do some hand expressing after you just jumped out of a shower, or you can use some heat packs on your breast prior to doing some hand expressing. Some mums, they like to use their electric breast pump and will do 2 to 5 minutes on the stimulation cycle of your breast pump first, and then do some hand expressing. But it's totally up to you. So after your breasts are nice and warm, I'm just going to tilt the camera. There we go. After your breasts are really nice and warm, after a shower or a warm compress, then you can do some just very gentle, soft tissue massage through your breasts to get them all nice and soft and supple. And then we can begin hand expressing. So what we got to remember when we're doing some hand expressing with our breasts is, where is the milk located, or where is the colostrum located? And the answer is, it's actually right up here in all the breast tissue. So what we want to be doing is actually compressing and moving that milk or colostrum down into that nipple vessel, and then obviously outside of the body as well. So it's a really good idea to, you can basically start wherever you're comfortable, and a good location point is often if you put your fingers on, this little breast has a very large areola, and areolas come in all different shapes and sizes, but usually 2 or 3 centimeters away from the edge of your nipple can be a really good location point. Sometimes that is on the edge of the areola and the breast tissue. And then what we need to do is, you actually need to gently squeeze into your breast, so you're pushing back into your body, and then you actually roll down towards the nipple. So we really shouldn't be having a lot of nipple involvement or nipple squeezing at all. It's really just, I'll readjust again, we really just move back and push into your body and then roll down towards your nipple. And you'll find with each little expression, you may get a couple of droplets, or you may get a little stream flowing. And so if you've got a stream flowing, pop a little cup underneath your nipple, and you can just squeeze your breast and hand express really nice and regularly. And when that milk flow slows down, do kind of move your fingers into a different breast tissue space as well, because there will be other ducts that you haven't been touching. And so we go here, and then we do that again. And just, it's a moderate pressure, but it's also, you shouldn't be damaging your breasts or bruising, or it shouldn't be hurting while you're doing hand expressing. It should just be in and rolling forward. And then we're going to catch that colostrum either with a cup, or depending on whether we're getting a couple of little droplets, we can also do that with the syringe. So we're just rolling forward, and then you can just syringe that milk up. and then we can store it. I also want to have a chat and say that if you are not getting copious amounts of colostrum, it actually doesn't mean anything in relation to your breastfeeding journey. So basically the body needs to have the placenta separated from the uterus to create a different hormonal cascade. So some mums will get copious amounts of colostrum during their pregnancy, and our breasts do start producing colostrum from about 16 weeks gestation. So it's not unusual for mums to notice that they're leaking at certain times. However, if you're not getting a lot of colostrum via antenatal expressing, please don't panic, because it absolutely has no indication of your ability to breastfeed your baby once baby is earthside. Okay, so I hope that was really nice and helpful for you all, and have a great day. See you later.